Hi, Scott Livingston here from ReconditioningHQ.com. The other day I talked a little bit about the concept of the foot shin angle, the ability to inside cut or outside cut, where that has to be. Today what I want to do is talk a little bit about the progression to being able to do that if we don't have the appropriate foot mobility or movement. What we want to do is get down onto the ground in that single knee stance and start to become connected to where our foot position is. So foot underneath us, can we position the foot, weight bearing on big toe, little toe, heel, a lot of weight over top or normal weight over top of the entire transverse arch, the entire arch of the metatarsals. So is there a good load bearing across the foot? And then where is the talus in space? Is that the dome of the talus, which we can feel with our fingers right at the front, is it medial, is it lateral, is it centralized? So we want to have a centrated foot. Then from that, can we shift into dorsiflexion over and back? Can we medially glide the tibia and laterally glide the tibia over top of that foot and still keep all those points of contact? Essentially dissociate the tibia from the foot contact position. We want to be able to create that point of fixation from the ground up when we're cutting. So then what we can do is, if we want the inside cut, can we bring that foot medially across the body, still keep a square body above it, and work actually to activate into dorsiflexion, lateral glide, and still stay stable, medial glide? Can we translate that? And then can we take it laterally? And again, move it outwards and inwards, dorsiflex over top of that grounded foot. From there, we can come up to a half stance. We can be in that half stance, glide forward and back, shift the knee medially, laterally. We can take it to a more inside cut position, square up the hips. Can we move that femur again and tibia on top of that foot? Can we take it out laterally? And can we still move that, okay? Then we can take it into a stepping action. So can we step, produce the landing position we want, step? Can we step laterally and produce the position we want? Can we step and actually action two? Can we come back into it, step onto it, ground it, and action two and through? And then if we want to, can we step and absorb? Can we step and absorb? A lot like what we did from that lateral slide or lateral glide motion. We can use that, sometimes referred to as the curtsy squat, or I call it a knee drop squat, where we drop down the knee backside, keep that foot in good position, and move through. Drop in, and this can become a really good action, warm-up type of movement, keeping the hips square and actioning and keeping that foot stable with the action of the tibia on top. So a little conceptual model for progressing, making sure that we have good foot contact for inside and outside cuts. Take care.